This is Chapter 11, Part 4. We're going to discuss injuries to the muscular system. So some running injuries can be relatively minor, but some can actually be pretty serious. If left untreated or treated improperly, minor injuries can actually become chronic. So running injuries are frequently related to faulty training techniques, which may involve improper or lack of sufficient warm-up routines, running too much, or also running too soon after an injury. Most sports injuries are treated initially with price therapy. So this stands for protection, rest, ice, compression, and elevation. So follow-up treatment after price, this could include massage to improve blood flow to the injured area, or also medications. One of these medications would be NSAIDs. And NSAIDs stands for non-steroidal anti-inflammatory drugs. So we get non-steroidal anti-inflammatory drugs, or NSAIDs. And these medications, as well as corticosteroid injections, these can both help for pain relief. Also, during the recovery period, it's important to stay active still, using an alternative fitness program that doesn't worsen the original injury. So we would do rehabilitative exercises. As we kind of briefly looked at earlier, skeletal muscles in the limbs are organized into functional units that are actually called compartments. So in a disorder called compartment syndrome, some external or internal pressure constricts the structure within a compartment, and this results in damaged blood vessels and subsequent reduction to the blood supply to the structures within the compartment. These specific compartments of the muscular system of the limbs specifically is not terribly important. We do cover a little bit in lab, but just know that the muscles in the limbs are separated into compartments that are separated by fascia. So when we have this compartment syndrome, this is where we have that damage or decreased blood supply to a certain compartment. And if left untreated, we can have nerves that suffer damage, and also muscles could die because of that lack of blood supply, or they could also develop scar tissue. One treatment is called a fasciotomy, and this is a surgical procedure where the muscle fascia is actually cut to relieve that pressure. So I'll rewrite that here, fasciotomy. So this will actually cut the fascia that's surrounding the compartment, and this will relieve the pressure and kind of allow that blood flow to come back in, because if we do leave that untreated, it can result in quite severe damage to the limb and to the compartment. Plantar fasciitis, also called painful heel syndrome, this is an inflammatory reaction due to a chronic irritation of the plantar fascia, or the planta aponeurosis. So this is at its origin on the calcaneus. So this is at the calcaneus, plantar irritation of the plantar aponeurosis, and the aponeurosis is the fascia of the heel there. Treatments for this, we do have ice, heat, stretching, also like reducing the causes of having that chronic irritation. So this would be weight loss or prosthetics. We also may include steroid injections. Also surgery would be another treatment for plantar fasciitis. And that's the end of chapter 11.